Everybody who's joining us tonight. My name is Tamar Zapolansky. As Danielle stated, I am a dermatologist with Valley Medical Group in Ridgewood. Thank you so much, everyone, for taking the time to join us tonight. I am going to talk about some skincare tips that are helpful for anyone that's looking to take good care of their skin. And this talk is organized in such a way that we will go through it sort of together, and you can keep track of where we are in the talk. So we're going to go through 10 skincare tips. This is the list of tips that we are going to talk about. The first one is my favorite, which I can never leave out, and that is sunscreen. So anybody who knows me knows that I cannot talk enough about the importance of sunscreen. What kind of dermatologist would I be otherwise? We know that exposure to ultraviolet radiation, which comes from the sun, is a leading cause of skin cancer. And we also know that sun damage is the #1 cause of wrinkles, discoloration, and other things that cause our skin to look more mature over the years. So we've had lots of data that has shown the skin cancer piece. We now actually have data that shows that using sunscreen and protecting your skin from the sun can actually prevent the aging of the skin. So it was published in the Annals of Internal Medicine in 2013. And we also had a very sort of landmark picture that was published in 2012, which is one of my favorites, basically because a picture tends to speak 1,000 words. This is a truck driver who spent most of his life driving a truck with the window down. And as we can see, the left side of his face is clearly, looking a little bit older and more mature than the right side of his face. I'm a big fan of these pictures because they really sort of drive home the point. And this is sort of a perfect study that is done in medicine when you have twins who are genetically exactly the same. This is a pair of identical twins. The one who lives in Florida is obvious. The other twin lived most of her life in Ohio and didn't, see a lot of sun. And then the last sort of picture that I want to share is this woman who was a receptionist. She was an office worker for many years, and the picture in slide A is very obviously the side of her face that was next to a window. And the reason that this is relevant is that to drive home the point that UVA does go through glass. So when we are driving around in our cars, we are getting some UV damage. And that is, the reason why it's good to use a daily moisturizer with sunscreen that, even if you're not really going to be spending too much time outdoors, this drives home the point that driving in cars, standing in kitchens, preparing food for prolonged periods of time, we are getting some UV that comes through the windows. So the moral of the story here is that I recommend that everybody wear sunscreen every day, not just on the days when you go to the beach or the pool and are spending the whole day outside. A little bit of sunscreen on the face is super important. We want to do this even if it's cloudy or raining or snowing. We want to apply it liberally. And I do like to make the point that the amount of sunscreen that is in some makeup products is not frequently enough for those that do choose to wear makeup. So it's important to layer some sunscreen underneath those makeup products. What you want to look for on the labeling is, and I'm going to talk about this more in a little bit, but it should say broad spectrum and SPF 30. That's sort of like the take home point. But I do get more questions about the details of, which sunscreen is good for me. And there's one big difference that's important, I think, for people to be aware of We have chemical sunscreens and we have mineral sunscreens. Those are the two types of ingredients. The ones that are in green here are the chemical sunscreens. It's much easier to remember the mineral sunscreens because there's only two of them. So if you need a mineral sunscreen, mainly because your skin is sensitive, the zinc oxide or titanium dioxide is the ingredient you want to look for. The other chemical sunscreens are totally safe to be used, but they do sometimes cause irritation. If somebody has sensitive skin, or if somebody's doing an activity like running outside and it gets in your eyes, you want to avoid the chemical sunscreens. And the FDA did do a little bit of work to make it easy for people to approach these bottles of sunscreen, which sometimes are a little bit overwhelming. You want to look for the above the line ingredients. Those are the ones that I just circled in red. Those active ingredients, that list is going to tell you, what are the sunscreen ingredients, and so you can identify if they're chemical or mineral. And then they also made new rules, new in 2011, that they have to say broad spectrum. So the bottle does have to be labeled with broad spectrum and the SPF number. I do get asked for specific recommendations, so I've thrown up here some of my favorites. The good news is that there are many options now. Lots of products that have a daily moisturizer with a sunscreen built right in. I do love the tinted sunscreens. They help to hide the whiteness of the zinc if that is something of concern. But there's lots of products now that are labeled, as sheer mineral. For example, this Cetaphil over here is really easy to find in the drugstore. Neutrogena came out with this tinted line now. And there's variety. The Brush on Block powder is also one of my favorites because it's good for hair-bearing areas. So scalps, areas where maybe you don't want to wear a hat, feel like wearing a hat. There's variety. So there's really no excuse for not being able to find a sunscreen that you like or that works for you. And at the end of the day, the best sunscreen is the one that you will use. So this is one of my favorite one-liners. If I don't like a product or it doesn't make me feel comfortable, I'm not going to use it. I just won't be compliant. So it's key to, play around, find one you like, and then that'll make it easy to stick to it. Okay, moving on to tip number 2, which is sort of related to tip number 1. Sun protective clothing and hats and sunglasses are sort of an important part of the full sun protection plan. So it's not enough to just put on the sunscreen and go lay by the pool. It's also important to physically protect yourself from the sun. So sitting under an umbrella, of course, is important. But this sun protective clothing that has become popular in recent years is hugely helpful. It's really easy to find it. You want to look for something that says UPF 50 plus on the label. Basically want to hold the item up to the light, make sure that the sun doesn't come through, and that's how you know it's a good product. And this is just sort of in combination with the sunscreen. It's not a one or the other. It's using them together. And one of my specific sort of pet peeves about sun protective clothing and rash guards is that I always insist on buying ones that have a full zipper. To me, because I tend to be practical, this makes it so that, I can go to the beach or the pool with my family, put on my sunscreen, and if I feel lazy to reapply or I feel like it's getting hot, the umbrella is not good enough, it's really easy to throw this on over a bathing suit. And conversely, if it gets wet in the swimming pool, you can easily remove it, hang it over a chair to dry. So looking for those full zip rash guards, it's just my personal tip. Okay, I will get off my sun protection soapbox now, and I'm going to move on to talking about vitamin A derivatives. So vitamin A derivatives are, they are an ingredient that has been studied and proven to improve the skin. It's one of my favorite ingredients because there's actual data that shows it works. So these ingredients stimulate cell turnover, they exfoliate the skin, they increase collagen production, studies have shown, they do before and afters where they take samples of skin and they actually do produce collagen. They minimize fine lines and even out the skin tone. It can be a little bit overwhelming to look at all of these ingredients. There are over-the-counter products that are available: retinol, retinol palmitate, retinaldehyde, and adapalene. And then there is a few of these that are by prescription. So tretinoin, adapalene, tazarotene, and trifarotene, those are ones that you would need a doctor's prescription to purchase. But just to throw out some specifics, my favorite entry-level ones are listed here. So I will give some specific names. The key to these ingredients is to use them cautiously. So you want to apply them at night for the most part, apply a thin layer or a pea-sized amount. Be aware that they can be irritating a little bit to the skin. It is normal to feel that when you're using these ingredients, and slowly build tolerance over time. So starting out once or twice a week and then moving up as tolerated. The two products that are listed here, I do have photos for everyone to see. Differin used to be available by prescription, and it was made available over the counter by the FDA, which is very convenient. And Retrinol happens to be a product that is similar in efficacy, but slightly less irritating. So the Differin gel is the adapalene, and you'll find this in the acne section of the drugstore. It is used for acne, but it also works as a treatment and prevention for photo damage. So just one thing I'll point out is that you don't have to buy the brand name here. You can get, the CVS or Walgreens version of the adapalene gel, and it's the same exact ingredient. And this second product, which is my second favorite entry-level retinol, is called Retrinal. It's a little bit gentler, less irritating, slightly higher price point, but also a good product for somebody that wants a retinol but can't tolerate the adapalene gel. And this is sort of a new addition to this talk, in case anybody has seen elements of this talk before. Bakuchiol is a new sort of cosmeceutical that is out there, and it is considered to be a retinol alternative. So it is even gentler than the products I talked about just now. But studies show the similar efficacy with retinol. So they're not as strong as the prescription, but it's definitely a good starter because it doesn't turn on the chemical pathway that causes retinoid dermatitis or dryness and peeling. It's an easy to make product and it's chemically stable. So a good starter option for those that are sensitive. Okay, so moving on to antioxidants, which are cosmeceuticals that are very available now in the drugstore and also, in the Sephora and Ultas of the world. So just a little bit of science here. Why do we care about antioxidants and how can they help us? So there is an element out there called free radicals, which produce cell damage. This can happen in various organs of the body, the skin being one of them. And what antioxidants do is they prevent those free radicals from doing the cell damage. So thereby they protect our cells. And I love this cartoon because it makes it easy to understand. The free radicals try to attack our healthy cells, and the antioxidants prevent them from doing that. So we have lots of studies that demonstrate their positive effects. Many people have heard about, the antioxidants in wine that help, prevent heart disease. And there are other studies showing that antioxidants are great for the skin as well. The question is, where do we find them? How do we get access to them? So fruits and vegetables, obviously. Seeds, nuts, green tea, red wine, these are just some examples. There's, in general, the healthier foods are the ones that are going to provide us with antioxidants. This photo here, I was excited to add to the talk because it recently gained some notoriety. If anybody has heard about the blue zones, areas of the world where people live to be, 90, 100 years old. And one of the areas tends to eat a lot of these purple sweet potatoes. So the studies show that these sweet potatoes actually have 3 times as many antioxidants as blueberries. So seeking out these healthy foods is a great source of antioxidants. Eating them is one thing. The next question is, does it help if we apply them topically on our skin? And the answer is yes, but there is a but. The but is that the concentration, the stability, and the penetrability of these ingredients is varied. So I will provide a couple of tips on, buying a good product that has antioxidant in it. And the other thing I want to point out is that it's important to use these as an adjunct to sunscreen. So sunscreen prevents our skin from developing free radicals. These antioxidants do sort of deal with them once they have been produced in our skin. So it's important to use these in combination. You can't just slap some vitamin C on your face and not use sunscreen when you go outside. So vitamin C happens to be the most popular antioxidant that people apply topically. There are 2 forms of vitamin C that are available in over-the-counter products. Ascorbic acid is the classic form. And there is another form which is called tetrahexyldecyl ascorbate, commonly known as THD ascorbate. The reason this is important that I like to point this out is that ascorbic acid is an acid and it can be irritating. So it's unstable and it's sometimes sold along with other acids to make sure it stays in its acid form, and therefore it can be a little irritating when applied. So if you have sensitive skin, you want to look for a product that's got THD ascorbate in it as the vitamin C form. As I mentioned, the ascorbic acid is very unstable when it's exposed to light and to air and light. So once it's oxidized, it's not so helpful to be applied topically. So you want to look for products that are sold in opaque tubes, air restrictive bottles, or pumps. Usually those are the ones that sometimes you have to pump it a couple of times to get the product to come out before it comes the first time. So those are important tips when you're shopping for these products. Again, a couple of examples. I do like that now there is a wide range of products at all different price points. So, you can find these in the drugstore. You can find these in some sort of more upscale stores as well. Online, Paula's Choice is a great line that really sells relatively naked ingredients. Vanicream is one of the first drugstore brands that has the THD ascorbate in it. So I really love that product because it has ceramides, it's moisturizing, and it's non-irritating. And it's a air-controlled pump. So that was vitamin C. I'm sort of gonna pivot a little bit here, and I'm gonna talk about wound care as an important a way to take care of your skin. This is one of my favorite pearls when I share with my patients. Most of them, are sort of surprised when I tell them that moist heals better than dry. So historically, in medicine, we used to intend to dry out all wounds and think that they would heal better that way. Sometimes they do heal more quickly when they're dry, but ultimately it results in more pain and more scarring. So if we want a wound to be less painful and heal with less scarring, it's better to keep it moist. So the landmark study that was done and published is shown here on this slide. This is a wound that was created on animal skin. And when it was treated with a standard dressing, just dry wound healing, keep it covered, it dried out and left more of a depressed scar. Here the scab is still in place. Moist wound healing resulted in sort of smooth skin that is at the same height as the surrounding skin. So when you have a boo-boo, you want to apply Vaseline and bandage or gauze and continue to replace it until the skin is basically normal. Vaseline is, my favorite thing to use on wounds. There are some fancier Vaselines out there. So Aquaphor, many people are familiar with. CeraVe Healing Ointment is a new one. These are just basically fancy Vaseline. I'm definitely okay with my patients using these. What the importance of this slide is to point out that we do not want to use Neosporin. So Neosporin or triple antibiotic ointment contains 3 antibiotics, one of which is not that helpful and can cause rashes. And so this is neomycin. It actually has very limited sensitivity with bacteria anyway. So sometimes it can actually result in worse wound healing. If somebody really wants to use an over-the-counter antibiotic, you can look for the antibiotic ointments that have 2 ingredients in them, bacitracin and polymyxin B. Historically, it was easy, and I would tell people to just buy polysporin instead of Neosporin, but I recently saw a polysporin product that had all 3 antibiotics in it. So the important lesson here is to avoid neomycin. You can get a contact dermatitis and end up with a worse scar, and to basically use Vaseline instead. One more take-home point, we do not need any of these ingredients for wound care. If a wound is very dirty, cleaning it initially with hydrogen peroxide is okay, but repeatedly cleaning a wound with peroxide basically gets rid of the good cells as well as the bad, and it delays wound healing. The second portion of talking about wound care or scars is that silicone-containing products have been shown to help prevent scars, treat lumpy, bumpy scars, and now they are readily available. It used to be difficult to find them, but I love that my patients can get these in the drugstore. You just want to look for products that are 100% silicone. There's evidence showing these work. And the vitamin E oil that you see in the corner there is going to get a big X from me. We have studies that show that vitamin E causes contact dermatitis, and it is no better than Vaseline at the resultant scar after a wound heals. Okay. This slide is something that is a topic that's also one of my favorites. Any of my patients who have seen me in the office know that I am always wearing my compression stockings, sort of one of my, it used to be my secret. Now I see that lots of healthcare providers are using them. Lots of people who work in hospitals and are standing all day are wearing compression stockings. They prevent varicose veins. They help treat swelling. They prevent swelling. They prevent rashes that happen when there's too much swelling in the skin. And my favorite is that they are an adjunct to healing wounds. So when you have a wound, a scratch, a scrape, something on the lower extremity that looks like it doesn't want to heal or that it's taking a long time to heal, wearing a snug sock up to the knee can really accelerate wound healing. So this is one of my favorite tips. And that, like I said, they're readily available, not as ugly or uncomfortable as they used to be historically. Okay, so a frequent request that I get is, what can I use on my thick, calloused skin? Most of the time it's on the feet, sometimes it's on other parts of the body. I just wanna plug a few ingredients that are important to look for if you're looking for a product that will soften and smooth your skin. So urea is a humectant. It draws water from the body into the skin. And lactic acid is an exfoliant. It helps get rid of skin cells that are already dead. And so these two together are a great combination for softening up, heels, knees, elbows. If possible, you apply them every night, and wearing cotton socks over the feet can be really helpful because it occludes the ingredients and helps them penetrate a little bit better. This Eucerin line happens to be one of my favorites and one of my go-tos. It's called Roughness Relief, and they are the highest combination of these ingredients that I've found to be available over the counter. One little thing that's important to mention is that the acids, if they've got, alpha hydroxy acids in them, they can make the skin sensitive to the sun. So if you're using this in a sun exposed area, you do want to sun protect those areas while you're using this cream. Sort of on the topic of these acids, I'm going to move on to talking about exfoliation. This is a question that I get sometimes from my patients, which exfoliator is best for me? I will say that products like the one that's, shown up here, I can 100% say I never recommend. So physical exfoliation or using a product that has abrasive particles in it is almost never necessary, and usually just causes micro injuries to the skin, worsening the initial issue. So if somebody wants to use an exfoliator, I always turn to chemical exfoliation, and these are the acids. The important thing to do here is choose a product that's right for your skin type, and I'll get to that in a minute. And also to realize that this does not need to be done frequently. Once, maybe twice a week, as tolerated. Some might find that they only need it twice a month to get rid of some of the dead skin cells. And this also might be seasonal, depending on if it's extra dry or extra humid, and the region of the country where you're living. So because I know that people like very specific recommendations, this is it's not always so black and white. However, in general, glycolic acid is a great acid for combination skin. Salicylic acid is what's called lipophilic. So this is why we use it so much in people who have acne. It goes deep down into the sebaceous glands. So it's good to use if you have oily or acne prone skin. Lactic acid is good for dry skin. Mandelic acid is great for sensitive skin. It's a very gentle acid. And lastly, azelaic acid, we like to use a lot in dermatology. It has some qualities that help inhibit pigment formation. It inhibits the enzyme that creates pigment. So, so if you have some, dark spots or uneven skin tone, azelaic acid is a good option. I love that these products are readily available now. It used to be a little difficult for people to find skincare products. It's just important to read labels and know what you're applying. So this is a really nice glycolic lactic acid blend available in the drugstore, reasonable price point. The only thing I don't like about this product is that it has the word nightly on there. So we do not need to use this product nightly. It's good to be, if you want to buy this product, you think about it as maybe like a once a week treat that you're doing, sort of an at-home facial, once a week, maybe, every other week. Okay. Number 9 on the list that I'm going to address is, I added it recently to this list because lots of people are talking about it. There is a term out there now called sugar sag. And so what is sugar sag? Sugar, in general, we know too much sugar is not great for our bodies. So this also applies to the skin. When we ingest sugar, it bonds with proteins in our skin, and the resultant the process is called glycation. It creates these glycotoxins, which the acronym for these is called AGEs or AGEs. And basically what these toxins do is they age the skin. So this elastin and collagen, which are proteins in our skin, once they are glycated by sugar, they cause sagging. They also induce melanocytes to make more spots, create more dyspigmentation, and they also lead to increased inflammation. So the moral of the story is that too much sugar is bad for us in general, but now we also have evidence that it does make our skin sag. So what can we do about this? It's important to prevent in this situation. Unfortunately, once sugar, the chemical molecules have combined with the proteins in the collagen, it is irreversible. So it's the main thing is that it's important to prevent. So managing sugar spikes in the diet has been proven to actually result in increased, in a reduced sagging appearance in the skin. And this is and we can do this by attempting a low glycemic diet. So there's lots of resources online to find, which foods are have a low glycemic index. In general, these have low sugar to begin with, but it also has to do with the ratio of fiber to free sugar. How to treat? Well, this is the million-dollar question, and we do need more studies on this. We know that adding antioxidants, which I spoke about before, is helpful, and it can help your skin create new collagen, because as we said, the old collagen is already sort of crumbled once the sugar has attached to it. And there are some studies that are being done with supplements. Can we take these antioxidants orally, and will that have the same effect in the skin? Some studies have shown that yes. I know the next question is going to be, which are they and where can I buy them? So, I don't have any specifics to recommend, because I think we do need to keep studying this topic. I will say that if you're looking to start a new supplement, it's important to talk to your doctor, make sure that there's no interactions with any medications you might be taking, because some of these supplements can have side effects. The last and very important topic I'm going to talk about is sleep. The sugar sag had a little bit to do with lifestyle change. Sleep, we've all heard the term, it's important to get your beauty sleep. And the truth is that this is very real. Repair occurs in our bodies while we sleep, everywhere in our bodies, but also in our skin. And so if we sleep less, we have more stress hormones, which leads to more inflammation. And this inflammation breaks down the collagen and the hyaluronic acid that keeps our skin looking youthful. It's also very well known that a common cause of dark circles and under eye swelling is tied to not sleeping enough, in addition to some other medical issues like seasonal allergies. But we know that more sleep definitely results in more beauty. These last two are definitely the most difficult lifestyle changes to make. I'm just glad to add them to this talk, because it reminds us that, some of these things which are good for our bodies are also great for our skin. So I will show you here that I practice what I preach. Here I am in my full zip rash guard layered over a bathing suit, and my kiddos are subject to the same torture. Thank you all for joining us tonight. Don't forget to keep calm and wear your sunscreen.